Thank you, TJ. Good morning. The April 7th, 2020 Douglas County Board of Commissioners meeting will come to order. Due to the COVID-19 crisis, this Board of Commissioners meeting is being conducted with the use of virtual technology within the guidelines of the Open Meetings Act under the emergency extenuating circumstances. Good morning to the citizens of Douglas County. I hope and pray that you and your families are doing well in the midst of this coronavirus pandemic. Many of us are facing fear and isolation during these uncertain times, and I want to encourage all of us by saying that there are better days ahead, and we are in this fight together, and we're standing on prayer and faith as we live through this extremely challenging moment in our lives. As of last night, we had 105 citizens who have tested positive, in which 5 citizens have died. My heart goes out to those who are recovering, our citizens who are recovering, and I extend heartfelt condolences to our citizens who have died as a result of COVID-19. And I pray that God give their families comfort during this hour of bereavement. Chief Scott Spencer, I've asked you if you could render the invocation this morning, and I believe you're on the line. Chief, could you please start off this morning with invocation? And Board of Commissioners, I have a flag that will appear on the screen, and then I will ask that everyone please, let's all pledge of allegiance, all in unison. Okay, so with no further ado, Chief Spencer, thank you for praying for our great county, great state, and our great nation. You have the floor, Chief.
Thank you, Chairman. Let us pray. Our Heavenly Father, as we come to you this morning, we know that we're in troubled times. Lord, we ask that we be reminded that you are in charge and you are in control. None of this has surprised you. Although we do fear things, Lord, we just ask that we put our faith in you and we cling to the promises that you've made to us. Lord, as we celebrate Easter this weekend, we're reminded that the church is not a building. The church is the people in that building. So as we do Easter a little different this weekend, Lord, we just ask that you be in the middle of it and that all praise and glory goes to you and your Son, Jesus. Lord, we celebrate his resurrection this weekend. And Lord, I just ask a special blessing on our county for all our leaders that are doing what they do, Lord. Just be with all of our leaders as they make the difficult decisions that have to be made. Lord, I ask a special blessing on the families that have lost members due to this COVID-19 virus. Just be with them, Lord. Give them your comfort and your peace. Lord, I ask that as our commissioners make decisions today, Lord, that you be in the midst of them, give them your guidance, your discernment, and your wisdom. Lord, I thank you for our county, I thank you for our state, and I thank you for our great nation. And we ask all of these things in your Son's holy name. Amen.
Amen. Amen. Board of Commissioners, at the Pledge of Allegiance. TJ. Okay, we ready? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Thank you all so much. Again, morning to the citizens of Douglas County and Board of Commissioners. Due to this unprecedented COVID-19 pandemic, there will be no public comment this morning. However, this administration wants to hear from all of our citizens, and I'm respectfully requesting you, our citizens, if you could just email your district commissioners or the county administrator or myself, and we will respond in the most expeditious manner and take your matter under advisement. Board of Commissioners, thank you again for joining this work session. This is our second virtual meeting, and I would like to just commend TJ Jagalinsky, and also our entire communications department, Rick Martin, who's the director, and his entire staff for working so diligently with us to pull this off. And thank you, our administrative staff, which is the Board of Commissioners administrative staff, Jessica and Mark Teal, and everyone for giving us the opportunity to experience the 21st century. Board of Commissioners, at our work session on yesterday, we had some pressing concerns about Cobb Douglas Public Health Service delivery during this COVID-19, particularly as it relates to testing and as it in Douglas County. And today I've requested Cobb Douglas Public Health Deputy Director Lisa Crossman to provide the Board of Commissioners and, most importantly, the citizens of Douglas County an update. Board of Commissioners, I just want to state that as we start the meeting, we will follow the Roberts Rules of Orders today. Please hold your questions to the end of the presentation. And during the meeting, I ask that you, during your discussion, if you would just limit your comments to 3 minutes, and then you certainly could come back with another 2-minute spin with the rebuttal if you had to. Clerk, please, I request your assistance this morning with monitoring the time, and commissioners and myself as well. Lisa, monitor me as well. When we hear the buzzer, we need to wrap up our thoughts so we can move on with our meeting. With no further ado, Deputy Director Cobb Douglas Public Health, Deputy Director Lisa Crossman, you have the floor, and I want to thank you so much for just taking my request on at a moment's notice, and we appreciate you being here today. Lisa Crossman, you have the floor.
Thank you, Chairman. I'm going to go ahead and share my screen to go through some of the information with you. And this will be made available to Rick and the communications team if you want to make it available to the community. So let me share that screen. Can you all see my screen?
Yes, I can.
Great.
Yes.
Okay. So I just want to hit, this is as of noon yesterday. We had about 331,000 cases in the United States, about 9,000 deaths. In Georgia, 7,300 cases and a hospitalization rate of about 18%. And that we had unfortunately seen 229 deaths as of yesterday at noon. In Douglas County, we had 102 cases as of noon yesterday, and unfortunately 5 deaths. I do want to warn you that I'm thinking that this is going to be a tough week for everybody because we hit about 3 weeks after the where we went into isolation and the shelter-in-place orders. And so we do expect these numbers. I won't be surprised if this number for Georgia goes up 1,500 today. So we're very concerned and we'll keep those reporting to you twice a day as usual. I did want to share with you a little bit about as we're looking at this spread and this outbreak, some of the heat maps that we have available that we've made. So I think I had shared this with you on the Thursday night town hall meeting that we did last week. And so I've updated that, and I just wanted to share that with the group today. So this is the number of cases. You can see Cobb County, Douglas County. And so I started out where Douglas County on March 13th, we didn't have any cases in Douglas. Then we went to March 20th, and you can see here that we had started to see some cases. Where you see the blue dots and the kind of the burgundy red, that's a certain number of cases. As that bright red comes in or the yellow comes in, that's just more cases in that area. March 30th, we saw it go to this in the district. And just so I'm clear, it doesn't mean that there's no cases here in Fulton County or the other counties surrounding. This is just our district, our public health district, that we're mapping these. And then we mapped it as of yesterday. And so you can see the continued spread of this outbreak in both counties. I went through yesterday as of noon and looked at the number of positive cases in surrounding counties to Douglas County. And so you can see the growth that we've seen. For example, I think we were in the 750s, just under 800 last Thursday night when I presented this to you for your town hall. And so you can see that Fulton County has already passed 1,000 cases. I think we were at about 60 cases in Douglas County last Thursday, and so we're already up to 102. I think that's going to go up to maybe 110 or so today. We'll see how those numbers look. So then you had some questions about the testing. So I added a few slides from our town hall meeting the other day to go into more detail about the testing eligibility guidelines throughout Georgia. This is not just in our district or in Douglas County. This is across the state. And so currently, these are the folks that we're trying to focus on with their testing. First of all, folks who have COVID-like symptoms, so fever, cough, shortness of breath, those, and they don't have to have all of those symptoms to be considered. So one or more of those symptoms and be in at least one of these categories. So our focus on across Georgia is trying to test those folks who would have the most impact on the community if they were positive. So that's where you get the first responders and the healthcare workers or individuals who work in group homes or nursing homes. But then we also are including those individuals who, if they were positive, tend to have the most severe symptoms. And so that's where you get the individuals who are over 60, those who have chronic medical conditions, or those who are currently living in a nursing home or group homes. So let me just let that stay on the screen for just a little bit so you can see who's being tested and who's eligible for testing, because I think this is a slightly larger group than what folks thought about in the community. And so we have put this on our website. I've sent this also over to Rick so that you all can make sure that those are on your website. As of yesterday at noon, again, we've done about 30,000 tests across the state of Georgia. You can see that in Georgia, our positivity rate of 24% or 18% is a bit higher than the nationwide rate. The reason for that is that in some places across the nation, they are not prioritizing the testing and they're testing anybody that comes in. And so you could imagine that if I came in and I didn't have symptoms and I wasn't in that high risk group, my likelihood of being positive would be lower. And so that's why you see this lower positivity rate across the nation. We do have limited availability across Georgia with our testing right now. So currently hospitals and many medical practices are doing testing. We have about 30 sites across Georgia who are offering drive-throughs. Our Georgia Public Health Lab does have limited supplies with doing the lab processing. We've currently collected about 34 specimens by public health. This doesn't include everybody who might have been tested through the hospital, through Wellstar Douglas Hospital, or through their medical practice that they may attend. And we have about a little under 20 folks who are in our queue to be tested today and tomorrow through CDPH. We are still having some delayed results from our lab processing, both commercial labs and the Georgia Public Health Labs. And this is frustrating for patients and providers. I'm hoping that we're going to see some improvement over the next week or so in this. I did want to let you know a couple of things that are developing. One is that as of yesterday, the pilot site that is a partnership between CVS Pharmacies and Georgia Tech opened their website yesterday for folks to be registered for testing for the 15-minute quick test. That site is ramping up, I believe today, unless something stopped it. The plan was for today, and they were going to be be able to do about 1,000 tests a day. And so we're excited about that opportunity. CVS is also launching a test site up in Rhode Island. Those are the only 2 sites in the country, one in Rhode Island, one in Atlanta, for those quick test results. And then we are expanding our Douglas testing. This has changed a bit overnight. We did try to launch this at our Selman Drive public health location yesterday, and there was some security issues and just the privacy issues that we were concerned about. So our emergency preparedness folks and our clinical folks are over in Douglas County this morning, looking at how to be able to provide that with a little more security and privacy. Scott and Jason, I know you're on the line, are John and Dennis and Catherine are going to be getting with you this morning. And hey, what Lisa, we need is just the slideshow. I'm sorry? This Mark.
Hey, could you start the slideshow so it'll be full screen?
Yeah.
Is that better?
It's the same.
So I think that in this format, it does do the same, because even I just did the start of slideshow. I have this same issue in Zoom where some reason it still shows it with the panel off to the side.
Okay, sorry.
That's all right. So we do RIS. So now we'll try there. Good idea, TJ. I only have, I think, 1 or 2 more slides, so we'll bear with it, okay? So what we'll be asking for the Douglas commissioners and the staff with Douglas County government is just some support as we set this up very quickly today to be able to start testing tomorrow or Thursday at the latest. We just want to make sure that the privacy and security is maintained and that we are ready to scale up in a heartbeat, because we do expect that testing is going to continue to increase, the availability of test kits, the availability of public health to do some of the quick testing. That seems to be ramping up and coming forward to us in the next week. So we're excited about that ability, and we'll just need to be able to set that up in Douglas County to scale up as we need. It still means that although one of our biggest priorities is on the testing, we do still need to work together to flatten the curve. And that's by everybody doing their part to stay at home and to practice the social distancing. I do feel like we're, Thursday when I was talking to you all, we were up on the kind of this part of the curve. Even though we have increased in the number of cases, I do feel like we're seeing a bit where we're moving over this way. So I would just ask everyone to continue to hold the course. And again, to reiterate why this is important in Douglas County, we still do not have any vaccine or treatment. We have one hospital that has limited ICU beds. We do have a growing number of cases each day in Douglas and our surrounding counties. And we do have, we know that the incubation period on this virus is up to 14 days. And it even shows that we could be infectious 2 days or so prior to showing symptoms. So our efforts that you all have passed with your executive orders, with the shelters in place, all the effort that people are making are really extraordinary and right on the mark, where we have looked at the data from other countries, and we have found that they have waited until they have this widespread where it's just all blue on the maps. then we're behind the virus and it's already too late. So you can see in another county, I wanted to give you this example. We have another county where we've deployed a lot of resources in Georgia to Daugherty County. You may have heard about this. They have a population about 90,000, so they're a bit smaller than Douglas. They are already up to 716 cases and 31 deaths. The main reason for that was before the shelter in place and the social distancing messages came across and were put into place, we had a couple of large funerals and large church services in that community. And so that's why we're seeing so many cases right now down in that community. And we've recently this week or late last week deployed the National Guard down there to help expand their beds and also to help with more in-depth cleaning of some of their long-term care facilities and some of their areas. So I do think that the solution is what you have already approved and what you've put in place. One is to stay home unless seeking or providing essential services. Those essential services are things that you need to live and be safe. When you do go out, please make sure to remain 6 feet away from other folks. Keep your groups under 10. You know, there's going to be some exceptions to that, of course. You can't go to the doctor and have him care for you from 6 feet away or her care for you. So there are certainly some exceptions to that, but whenever possible, please maintain that distance. If you're sick, stay home. And I want to add one more thing that's come up in the last couple of days, which is the face coverings. We are still pleading very seriously with folks to not use clinical medical supplies if you are not a healthcare provider or a first responder. Our statewide and even national resources for personal protective equipment are very limited. So we're trying to make sure that the medical masks and the surgical masks are reserved for our first responders and healthcare folks. But what you have heard is the face coverings idea. And so if you have ways to just have a t-shirt or a bandana or something like that when you go out in public, you certainly don't need to wear it when you're at home or sleep in it. But when you are going out in public, like to go to the grocery store or to the pharmacy, we do recommend that you wear these face coverings. The main reason is because you yourself might be contagious before you have symptoms. And so by wearing a face mask, it protects other people around you from being infected. We think it's just one more thing that each of us can do to help not spread this virus to people around us. And that ends my comments, Chairman, if however you want to proceed with the meeting.
Yes, thank you so much, Deputy Director Crossman, for your wonderful presentation. And also just thank you for providing the correlation between Daugherty County and Douglas County. Daugherty has 90,000 citizens. Douglas County has about 150. Daugherty has about 716 cases. Douglas County is at 102 as of last night. I thought, for some reason, I don't know why I said 105, but it shows that the things that we've done, getting out of the gate early, certainly focusing on social distancing, moving forward with the shelter in place, it certainly was not as aggressive as Governor Kemp's. But however, now since his orders in place, we've even taken it to a whole new level. One of our doctors last night on the meeting from Emory, as I was meeting with Congressman Scott last night, was on his town hall meeting, didn't meet with him directly, but of course heard that the doctor at Emory says the curve appears to be flattening somewhat. So she didn't want to celebrate too early, but she did give some indication that it was flattening. Certainly I wanted to, a couple of questions, and then I'm certainly going to yield to my Board of Commissioners because I really brought you so they can ask questions this morning. How many sites are in Cobb? Is it 3 sites? How many sites do we have in Cobb?
Just one, Chairman. We have the one large location at Jim Miller Park, that we've been testing in the district for Cobb and Douglas. And then this week we'll ramp up the location in Douglas County.
Okay, and then my second question is criteria basis to administer COVID testing for Douglas County. Is there a different criteria basis used for Cobb citizens, or is this criteria, is it like a standard triage system that's being used across the state of Georgia to determine who gets tested? Because what I wanted to make sure that the citizens of Douglas County is just, we're getting our fair share. So can you explain that to my Board of Commissioners, please?
Sure. Thank you, Chairman. That the guidelines that I had gone over with you about it needs to be a person who is symptomatic and that they're in one of those categories. So, for example, they are a healthcare worker or a first responder, they are over 60 years old, or they're a caregiver for an elderly person, that they have a certain number of, they have chronic medical conditions, or they are a caregiver of someone who has those chronic medical conditions, or they live in a group setting like a long-term care facility or a shelter. All of those folks, all of those guidelines are consistent across Georgia. And that's the same guidelines we've been using in Cobb County, and they will be the same guidelines that we'll use in Douglas County, unless, and my fingers are crossed for this, unless we see that we are able to get more test kits. And I told you that all of those things seem to be getting set in place to be able to do more testing. As more testing becomes available, we will release some of those eligibility guidelines or relax them. And so that will be across the state as well.
Okay, thank you so much. Board of Commissioners, I really didn't, with this new system, I have to call roll because I don't know who's on here because we have 4 photographs at a time. Vice Chairman Robinson, I see you. Commissioner Mitchell, are you on?
Yes, I'm here.
Okay, Commissioner Carthen, are you here?
Yes.
Okay, and Commissioner Ann Jones-Guyder, are you here? I saw you earlier.
Yes.
Okay. All right. Well, I'm going to yield to my Board of Commissioners. Certainly, this is as a platform for you to ask questions, and I will just, Vice Chairman Robinson, I believe you raised your hand. I saw you. Mm-hmm.
You saw me. Okay.
Yes.
All right. I'll be very quick, and I appreciate the presentation. Ms. Crossman, thank you once again for coming before us. We met a couple of weeks ago when we were passing our shelter in place, and I've got allergies, so don't worry about it. And we were sheltering in place. And one of the things I was driving home the whole point was this need for both testing and data. And at that time, it seems like it fell on deaf ears, the importance of it. Now, it wasn't not do the sheltering in place. It was also doing the testing. It was not either or, it was both. It was both. So that being said, here we are full circle, right? And I appreciate the emphasis on the need to do testing in Douglas. We are part of the district. We do contribute to public health budget. All those things are important. So part of this conversation was about, do you see us? Do you recognize us? So that's some of the advocacy that you hear coming from the districts. All right, so my question is about this community spread. And it just seems like there's an evasive answering to the point, well, high, medium, or low? How saturated is the Garden of Douglas? Is it not, and it goes deeper than just the fact that we've got this number of cases and we've got a dispersion map. I think you know what I'm talking about. Like, okay, but the only way you can get there is through testing. And the question is, and I'm hearing the priorities. I get it. I get the vulnerable. I get our first responders. But what about everybody else? And some of this is about assurances. It's not suggesting that we're taught test everybody. That's not medical protocol. But there is a reasonable sample size, right? For those who get this, there's a reasonable sample size for any type of situation. You say, well, what would represent the full body of 150,000 people? What's the representative sample? What's the number we need to get a nice, and it just seems like we're avoiding that. Now, don't get me wrong, and My issue was the difference between a medical approach or a legislative approach. If it's medical, I need to hear more medical. But what I'm hearing is a lot of legislative actions to try to cure a medical issue. And that's really been my biggest issue. So I guess to make my comments, I'd like to know about the community spread and what would be the total number. And if you don't know the answer, Lisa, it's okay. What would be the total number of people we need to get a representative spread? So is it 30% of our population, 20%, or 10%? To get a nice, I'm trying to get an indication of, well, how bad is it? We've heard other states talk about high, medium, and low. So I want that answered. And the last one is about these test kits and the need to move faster. And I appreciate it. But that was my whole point. Don't make it plan A, then do B. We should have been moving B all along. So by the time this came off, we'd be ready. So, but I know that we're running fast. I get it. But we're also here to add, like we see different parts of this elephant. And I think it's the collective voice that we all bring value to the table. So I hope my commentary is insightful and it's not critical. But again, our lives are at stake. So, Madam Chair, I just want to make those comments. I want my answers offline. If she doesn't have them, I yield the floor.
Thank you so much, Vice Chairman Robinson. Deputy Director, do you have a response? Thank you.
Yes.
You have the floor. Mm-hmm.
So let's see, it seemed like there were a few comments or questions that were in that. First, let me make sure that you all are assured that we are hearing and seeing Douglas County. There is never been an issue where we haven't seen you. I would say to you that we have 159 counties in the state of Georgia, and currently we had 30 test sites across the state. And so the idea was that those test sites were positioned strategically and geographically around the state to be able to serve all the residents, maybe not as conveniently as we'd like, but based on the testing opportunities that we had, the supplies that we had, that was the best strategy to be able to serve as many people. So I don't want you to think that we chose Cobb over Douglas. It was really in the district, let's figure out where we can put this to serve the most people. And so that's the first thing. The second is that I do agree with you, Commissioner, that we did need to continue to focus on testing, and we have continued to focus on testing. We didn't want to wait for anybody to make a decision about sheltering in place and social distancing until we had the testing in place. And so because there were many factors that had to be solved for the testing, we had a supplies issue, we had a lab processing time frame delay to issue. And so because of those delays, we didn't want the state to wait until the testing was in place and all of the information about what was the spread or what was the prevalence in our community. We didn't want to wait on that before you all took action for the shelter in place. Because again, as we've seen across the world, if we waited until we had that information and all of those systems in place, we would have been behind the virus instead of in front of the virus. So now that all of that seems to be catching up on the testing, supplies, manufacturing, being able to have the machines deployed, being able to have the staff that can do the testing and the processing, I think that all of that is coming online this week or next week, so that you will see that we'll be able to get more of the actual prevalence. And that's important to us to be able to see that, because that's the only way we're going to know that these interventions have worked, and where we start to see the flattening of the curve and see the number of residents who are testing positive start to go on that downhill curve. I'll stop there, Chairman, if you...
Okay. All right. Any other commissioners have a comment or question?
Yes, ma'am.
Commissioner
District 4.
District 4, yes.
Okay. Lisa, when you were talking about the support that you would need from the county to set up the test site, exactly what kind of support? Can you be specific about the support?
Great question. Thank you, Commissioner. What we don't need the support for the actual clinical testing folks or the supplies. What I'm really going to be needing is support from your public safety folks to be able to make sure that we have a secure area so that it's fenced off and able to be locked up at night. We also want to make sure that we have everything in place with cones, and that we can help manage that drive-through process and help manage the security at the time of the testing. So it's really more of a public safety support that we'll need, and a location from you, approval to do this at a certain location.
Okay, so you're not going to use the health center? I thought you were going to use the public health center for the testing. No,
we were yesterday, but when we set it yesterday, as we set it up, we found that even though we can handle a small volume of tests over there, it doesn't provide the privacy and it doesn't provide the security at that location that we feel like we need. So that's why our staff went out there first thing. They were out there at about 7 this morning, looking at some other locations or a different way to do that.
Okay. And I've heard from a lot of my constituents, they want to be able to go to the parks to walk around and get out in the fresh air and everything. I think Fulton County has their little gateway open, and it is causing problems over there. Could you just address why the parks are closed, and what would have to happen if we open some of the walking trails?
Chairman, do you want to take that, or do you want me to put the public health angle on it?
Put a public health angle, and then I'll come back.
Yes.
So, it really breaks our heart. Truly, it breaks our heart to not have people out exercising. We've spent decades talking to folks about how to reduce chronic conditions, particularly cardiac and cancer and that sort of thing, through physical activity. So we hate that we're saying this, but the problem we're having is that it just seems to be that folks are having a hard time maintaining that social distancing when they're out. When we've been driving around before folks closed the parks, what we were seeing were a lot of families who were taking their children out to the playgrounds. And even on some of the walking trails, a lot of folks were gathered up very tightly. And so that just doesn't support that whole social distancing need. So for right now, as hard as it is for us to say this, we feel like that's the best route in order to get folks to shelter in place and to really stay home. And we still are recommending that maybe their family unit goes out and takes a walk in their neighborhood, or on the sidewalks, or gets out and plays in their yard to be physically active. The parks just seem to be a magnet for a lot of folks coming together and not doing the social distancing.
Okay, and one last question. It seemed like Douglas County was higher than some of the surrounding counties that's more our size, like Carroll and Fayette and Paulding. Do you think there's a reason behind that? Is it I-20 coming through Douglas County, or should we, and I hate to say this, but I've got to say it because I've had a lot of people from my district say the buses shouldn't be running, especially the one that's connecting to Cobb County and Fulton County. Do you have any public health recommendations on that?
So, Commissioner, it's a really good question. When I looked at yesterday at noon, I see that Douglas had 102, Carroll had 163, Fulton has 1,027 cases, Paulding has 54. I think the issue with Douglas, we see this across the metro area with just about any kind of disease or infectious disease outbreak like flu and other things, that there's not, we don't stay in our own county, right, to just get our services. People float among different areas across the metro Atlanta area. And so I think that the biggest issue for Douglas is that you're surrounded by Fulton and Cobb and Carroll, which are larger. And so the people in those communities don't stop when they get to the Douglas border. They're doing services or they have family across borders. So I think that's the biggest issue, is that you're just surrounded by some larger counties. To address your question about public transportation, there is some CDC guidance that talks about how to better provide bus service, because we do recognize that bus service is considered an essential service, right? Essential workers have to get to work, and if they don't have a way to do that, then they use public transportation. If you shut down public transportation, then they don't have a way to get to those essential services, either to provide them or get them for their own family. And so the best way we've been able to address that is, first of all of the bus lines, including Douglas and Cobb and the MARTA, have increased dramatically their disinfecting of their buses several times a day. The other is that when you are using the bus service, we recommend that you have as few touches, right, as possible, just like we recommend that you have as few touches as you can with places when you go to the grocery store or to the doctor's office. So we still recommend that same practice. And then I do know that because there have been a number of people who are not working right now, unfortunately, because of the non-essential businesses ramping down or closing, that many of the folks who have been using public transportation in the past are not. And so the ridership across the metro area is down significantly, which is bad on one hand, but on the other hand, from a social distancing perspective, it does give you a chance to be more spread out if you're on the bus. So it's certainly not a perfect situation, just like going to the grocery store isn't a perfect situation from a social distancing, but it is the best that folks can do right now.
I thank you, and with that, I yield back.
Commissioner, I just would add one more thing. I would say for folks who are riding buses or using any kind of public transportation, that we also are encouraging them that when they get off public transportation, to use hand sanitizer, to wash their hands at every point, just like I'd recommend to you when you get done at the grocery store and you get back in your car, use your hand sanitizer or wash your hands when you get home.
Should we have sanitizers on the bus as they enter the bus?
It's not a bad practice at all. It's certainly not a bad practice at all. If you have access to those supplies, I would say yes. A lot of people are carrying their own now. We are seeing a lot of people with the small, personal size hand sanitizer. So, it's not a bad practice at all to either have it on the bus or have people who, when they get on the bus, use it. When they get off the bus, just like we're recommending to everybody at every point where you're doing public interaction, to do the same thing.
Thank you. I yield back.
Okay, Commissioner Guide, I just want to add to what you were speaking about. Just wanted to mention that our van pool system was shut down a week ago, and typically that van pool transport 350 passengers back and forth to the Atlanta metro area for work. So that van pool is closed down because we could not, social distancing was not an option because everybody's just packed into the van. So that has been addressed. So I hope that helps. But again, we are focusing on those things. We want to focus on that social distancing. So the van pool has been shut down effectively last week. Okay. All right. Any other commissioners? I can't really see anybody's face except two commissioners, and I don't want to.
Commissioner Carthen.
Commissioner Carthen, thank you. You have the floor.
Ms. Crossman, how are you this morning? Good. So one of my questions is, what about those particular constituents who received a referral a week or so ago, but couldn't get to their appointments because the appointment was so far. Can they be seen to be tested if they still feel as though, or their physician feels as though it's necessary, if they already have their confirmation number and everything?
Absolutely. So we're going to handle those on kind of a case-by-case basis. So ideally, those folks would come to the primary Jim Miller Park location to get tested. If that's too far for them to travel, then they just need to tell us that when we are calling them for their appointment, and we can make arrangements to test them at the Douglas location, just individually, and we'll handle that.
I say that because I have two constituents, and one called me yesterday and left a message because she heard that we were finally getting testing here, and she wanted to know, since she had a confirmation number, could she just come? I told her to call Douglas Public Health before just going, but I just wanted to find that out. And then
you're welcome to give her my email address or my phone number, and I'll pass that along to our nurses so they can talk to that individual directly.
Okay.
Okay.
And but she's the one that I'm speaking of. She's way over 60, and she's caring for a husband that is ill. My second question. Test her. Yeah. Yeah. And my second question is in regards to the private and public sector getting test kits. It seems like the private sector is able to get more test kits than the public sector. Is there a reason why that happens?
Well, sometimes, so that's an interesting question. I don't have the answer to that because I do feel like the Strategic National Stockpile supplies and resources come down through the government channels. And so we do get priority on from that perspective. But there are times where you might have a commercial lab or commercial folks like CVS might have their own testing capability already in-house. And so they can prioritize that and ramp that directly. So I don't have a good answer for you on that one, other than it kind of comes down as the opportunities are available.
Okay. And
but I'll tell you, I have to say this too. Public health is very supportive of private groups doing the testing. It's just the same as we feel that it's wonderful to have a CVS or a Publix or Walgreens doing their testing, like their immunizations, and that doesn't have to just come through public health to have the immunizations, general immunizations, I mean, done. And so if the private sector can ramp this up, we're right there behind them. In fact, we had a bunch of folks from the National Guard and from the CVS folks and Georgia Tech out at our Jim Miller Park clinic, our testing site, because we had gotten some acclaim that we were able to do testing in about 1 minute and 45 seconds. And so everybody was really impressed with that efficiency of our staff. And so they came out to say, okay, show us how you're doing running folks through in the process. And they took that back to help set up their own locations.
Oh, that's really good. And my last question is in regards to the face mask. So what, if any, material is the best material to use? Since I know we don't want people using the N95 mask, is there materials that you can use around the house to make your face mask? What are those best materials?
Absolutely. And maybe what I can do after we finish this call is I can have those links sent to Rick, and they can put those out on y'all's website. So for example, let me show you what I have. So I don't know if you can see my Florida Gator mask. So this is a mask that actually Dr. Memark made me with this is kind of t-shirt. I mean, this is kind of regular cotton fabric, and it has a flannel lining inside of it. And then these are just hair ties on the outside. And so if you are not a seamstress like Dr. Memark obviously is, if you're not a seamstress, you can certainly take like a 14 by 14 bandana or a piece of a t-shirt material and fold that up and use hair ties, and it works great. The concept is that you just have some various layers of fabric and you can still breathe. We don't want to, we don't want you not to be able to breathe because you've got so much fabric over your face.
And that was one of the reasons why I was asking it. Yeah.
Right.
Yeah.
I'll send Rick those links because we even have one that's a great, if you haven't seen it, it's a YouTube video of our Surgeon General, our U.S. Surgeon General, making a mask out of a piece of t-shirt.
Okay, great.
Without sewing.
Thank you. I yield, Chairman Jones.
Okay, thank you, Commissioner Carthen. Commissioner Mitchell, do you have any questions before I proceed, or?
No, all is good. We're fine.
Oh, okay, thank you so much. Lisa, I just wanted to, I believe yesterday, I remember someone had a question about, can you tell us exactly how many citizens in Douglas County have been tested? And I know it's hard for you to compile all the information. You can only probably give us information relative to Cobb Douglas Public Health, but is there any way you can pull that, extrapolate that information out of the system to share with the Board of Commissioners and the citizens of Douglas County?
So it is difficult for me to know how many are tested at various locations like the hospitals and the doctor's offices. We have tested 34 people through Douglas County through the public health avenue, and we have just under 20 in queue to be tested this week at any location. So it's a very small number, but again, we obviously have more than that being tested because we have 102 positives. If we figure that we're having about a 25% positivity rate, right, give or take a percent, you could imagine that if we have 100 people that are positive, we've tested 400 through the hospitals and doctors' offices and everything.
Okay. Thank you so much. That helps. But if you could, I guess, extrapolate that information by contacting, I know you have probably the ability to chat with the hospitals to get that information. And if you could, that would be great. And just email it to me or, yeah, and I'll share it with our commissioners. All right. Thank you so much for taking the time out of your busy schedule to meet with our Board of Commissioners and the citizens of Douglas County this morning, because I want all our citizens to be well informed and everyone to be very well educated.
Thank you for the time on the issue. I know it's you all have a lot of important business to run all the time, and so I appreciate this much time on a public health topic. I appreciate your leadership.
Thank you. You're
and
welcome.
Just kudos to all of you, because I really do think you made a decision early on that was very difficult, but I think you made a decision early on that is really going to protect the residents of Douglas County by doing the shelter-in-place decisions early. So thank you for that too.
Thank you. Yeah, Daugherty versus Douglas right now, we're talking about competition. I love to compete, and I see they have 713. They have 90,000. We have 150. So thank you, Lisa, for just bringing that information to us. And also, I thank the public health, Cobb and Douglas Public Health, for just steering us in the right direction. And I appreciate the direct communication. We're in constant contact with one another, and I want us to keep this going. I want to encourage our citizens and also our Board of Commissioners. This is certainly a marathon, not a sprint, and it's day by day. So thank you for this information, and I look forward to you coming back to chat with us. TJ Jagielinsky I just wanted him to show the Board of Commissioners, if you could just share with them the COVID-19 Hub website demonstration. Are you there, TJ?
Madam Chair?
Yes.
This is Mark Teal. No, TJ is not able to share it. If he does, you won't be able to see it. So I'm sharing it. Let's see. Do you see it on the screen yet?
No.
Yeah, hold on one second. Here we go. Okay, what about now?
Yes.
Okay, so Ed Dean, our GIS manager, developed this. And he had a lot of help from Cobb Douglas Health and Jason, our EMA director, and Scott Spencer, our fire and EMS director. I'll just scroll through this. This is on our website. It is updated daily. So There's a lot of information on here. I won't go through the details on this, but Ed did a really good job on this. And again, I say it is updated daily. And I'll just scroll through, but it's on our website, and it is available.
And it has the mapping, and also it has the daily stats that are relative to Douglas County and plus the entire state and the country, correct?
Yes, ma'am.
And so I encourage our citizens, if you want an up-to-date progress report, please refer to our new hub website. It's our COVID-ID, COVID-19 website. And it's for all our citizens here in Douglas County. And they have done an extraordinary job providing all the data and information that's been requested. So thank you, Mark. Board of Commissioners, that information is available to you and also the citizens of Douglas County on our website.
Madam Chair?
Yes, Mark. I'm sorry. Is that Vice Chairman?
Yes, ma'am.
Yeah, Vice Chairman Robinson.
Yeah, excuse me. You mentioned that we would have perhaps one rebuttal, so I'll be very tight. I know there's a lot of emphasis on the public doing their part during a very stressful time. And it keeps being, you do your part. It keeps being instructive toward the citizens in light of the financial duress, the shelter in place as if it's not a big deal, and it's simmering, right? Like they said, there was more deaths than 6 wars that this thing has hit us this fast. I'm going to keep trying to bring back the point, which is there seems to be just this reluctance of data and testing. And it's something that we call, for those who really can hear, the value of perfect information. The more data you get, the richer your decision can make. Not that it would be perfect, but it just makes you more enlightened, right? And it's just, it's sort of like, well, hopefully you'll just self-resolve. And this is what they call the national healthcare debate at the local level, right? Like, okay, guys, what's the issue of testing? We're getting a lot of excuses, a lot of reasoning for like, okay, what is the issue? And it keeps being a redirect toward the public, but I'm going to keep coming back to the administration says, okay, guys, we get that. We're filling these people out here. They understand that, but I represent them to come look like, okay, but what about how long is it going to take you to get this up and get this going? I'm hearing, look how hard and restrictive and instructive it is to the public, but then we're like, well, we got to figure out how to get the personnel. Oh, we got to, it's like, okay, really, guys, it's not matching. And it's just, it's a care from my heart. I really care. I care about all of Douglas. I care from the perspective like, okay, come on, guys. And there just needs to be a matching of cadence. Again, it's not either or, it's both. At some point, we got to go back to work. I hear the priorities. I hear the people who have symptomatic and the vulnerable, and I get it. I've got an in-law that is on 80-some years old, doesn't look like they're gonna make it. I got it. And so my point being is, for the citizens, they need assurance that it's okay. And we're not giving them the assurance because we're going through this, well, you gotta be really, really dire to get tested. And I mean, it's almost like kids and work and vaccines and stuff like, did you get your shots? Did you do that? How are we gonna turn this thing back into, if we haven't addressed the issue of testing, it's the asymptomatic person that's walking around. I yield the floor. I'm good. Thank you, Madam Chair.
Thank you so much, Commissioner Robinson. Deputy Director, you look like you want to say something, then I'm gonna move on. Do you have something to say just to console the moment?
I just want to assure you that nothing has stopped. Our staff has been fully redirected to this issue, and all of our non-essential services staff has been redirected to this issue. So there is not the situation where I don't have enough staff to do the testing. They are trained and ready to go on a moment's notice to be able to do that. I would tell you that the hospital staff has done the same thing, that they are all redirected from non-essential services to be able to care for the folks of Douglas County on a moment's notice. And that we have our staff and the folks at the state are working 15 to 18 hours a day to get all of the testing supplies that we need down to the county level. And so You're exactly right that it is not a you do this and we'll sit back and watch and see if that works. It is certainly a joint effort that we are working as hard as humanly possible to get the test into Douglas County and to help folks with the right process for how to mitigate the disease. And then we are asking, because it is all we don't have a vaccine and we don't have a treatment, that the only way to get in front of this virus is if each of us does our part for the social distancing. So I do agree with you that it is a joint effort and that we are working and running the race to get to be able to do as much testing as possible. And we're running the race to be able to have people shelter in place as much as they can.
Deputy Director, excellent response. That's what I've been waiting to hear. Thank you. Madam Chair, I yield. Well done.
Okay, thank you so much. All right, we're going to move on to our next presentation is Dr. Gilchrist, and I want her to update the seniors, update our Board of Commissioners and our citizens about all the services that are being provided by our seniors. Dr. Gilchrist, are you there?
Good morning.
Good morning.
Can you hear me?
I can. Yes.
Yes. Good morning, Madam Chair, members of the Board of Commissioners. Thank you for this opportunity to provide this very helpful information to older adults in Douglas County, as well as all the citizens of Douglas County. Before I move into my presentation, I would just like to take a minute to thank our wonderful volunteers for their commitment during this time of uncertainty. Further, I would want to give a huge thank you to our amazing staff for their perseverance and their dedication to the older adults in Douglas County. I am grateful for their help and their service during this time of uncertainty. A note to the public, at this time, Douglas Senior Services, we continue to provide approximately 250 to 300 hot meals per day to older adults in the county. We also continue to provide non-emergency medical transportation. We have suspended our homemaker services at this time. For socialization and engagement, anyone, preferably our older adults, please join our Facebook Live, the Woody Fight Facebook Live page. Daily, you can find exercise groups, informational sessions, and various interactive games such as bingo, Family Feud, and trivia. Also, we have several of our members who they got together and they made scarves, face masks for our first responders. So we will be getting those out to our EMA department as soon as possible. They made over 250 face masks for our first responders. So I would also like to personally thank them for their efforts. Now I'll share my screen with everyone. I'll provide an update on resources for seniors in the county. Here, let's see. Can you see? Can everyone see the screen? No? No. Okay, hold on one second. Hold on. Okay, I'll just discuss it. Can you see it now? Okay.
Yeah.
So we have this information is posted on the Celebrate Douglas website, as well as our Woody Fight webpage and Douglas Senior Services webpage. They're just a few helpful resources for seniors. I'll start with some of the pharmacies. We have Taylor Pharmacy, Premier Drug Store, Sam's Club, Walgreens, and Wyatt's Pharmacy. as well as Publix and Kroger Pharmacy. They have special shopping hours, pharmacy pickup hours for seniors in the county. For instance, Publix on Tuesdays and Wednesdays from 7 to 8 a.m. They have special pharmacy hours where someone can speak directly with the pharmacist if need be. Also, we have several retail stores such as Dollar General, Target, and Walmart. They have special senior shopping hours. Dollar General, 8 a.m. to 9 a.m., Monday through Sunday. Target on Wednesdays from 8 a.m. to 9 a.m. and Walmart from 6 a.m. to 7 a.m. every Tuesday. Those are the special hours for older adults. Also, we have the several exercise videos that can be on our Woody Fight Facebook page. We posted those, some links to those exercise videos. And again, all of this information can be found on celebratedouglas.com. And I'm trying to pull up now the other helpful, I hate you guys can't see my screen, 1 second.
It has come up.
Is it up?
We can see on.
Okay, you'll follow me, TJ? Okay, thank you. So important phone numbers and links. We have the COVID-19 hotline. That number is posted. Cobb Douglas Public Health, there's a link to their website. Douglas Senior Services and Woody Fight. Our numbers are on this flyer, 770-489-3100. Any older adult can call that phone number, and if we don't answer, please leave a message and we will return your call as expeditiously as possible. Also, we have several food banks in the area, the Sweetwater Mission in Austell, 770-819-0662. They provide express food, but with limited social contact. Also, the Pantry, 770-217-0729, every Saturday from 9 until 12 noon.
Trying to take notes as they talk.
Okay.
Is that, what's his name?
That's TJ.
But what's he doing there?
He's
the food delivery services. These are great resources for older adults. There's Instacart and Uber Eats. So if you're not able to leave your home or choose not to leave your home, you can also sign up online to have your food delivered to you from any grocery store or retail store. And that's INSTACART.com. And also Uber Eats will deliver from most restaurants in the area. I love this. The next one, transportation, is called GoGo Grandparents, and it's specifically for seniors, 1-855-464-6872. Then we have several grocery stores in the area that provide shopping time, designated shopping times for older adults. We have the Farmer's Table. Their number is 770-693-0171. They provide free delivery within 4 miles of their location. You can also call in, carry out, and there's curbside service available. Ingles, Kroger, Publix, Sam's, and Walmart, they each have specified shopping times. Ingles from 7 a.m. to 8 a.m. only on Tuesdays and Wednesdays. The store is open for older adults. Kroger, age 60 plus, 7 a.m. Monday through Thursday. Publix, age 65 and older, 7 a.m. to 8 a.m. Tuesdays and Wednesdays. Sam's Club, Thursday only, Also, Sam's, they've added a new feature. They actually have curbside ordering. Anyone with a disability or at high risk, considered at high risk, can pull up an associate, a Sam's associate will take your order, go into the store, gather the items for you, and then bring them back to your vehicle. And that's on Thursdays only at Sam's. And then Walmart have special shopping hours from 6 a.m. to 7 a.m. Tuesdays only. Monarch Family Dentistry, they're providing emergency dental needs, only emergency dental needs, and their telephone number is 678-502-1702. One other thing that I think is very pertinent is the Georgia Council on Substance Abuse. They're doing free recovery sessions via the telephone. Again, that's the Georgia Council on Substance Abuse, and their telephone number is 1-844-326-5400. Okay, TJ, that ends my presentations. Are there any questions?
Thank you, Dr. Gilchrist, certainly, and thank you. This information it's on the Celebrate Douglas website for our citizens or seniors as well to pull a copy down as well. Did you mail out or did you send emails to our seniors? How did they receive this information? I believe you said 9,000 seniors have this information.
Yes, we emailed, we have over 9,000 seniors in our database. We emailed this to the 9,000 seniors. We also sent it out with our Meals on Wheels. And prior to suspending our homemaker services, we sent this out to those clients that receive homemaker services. One of the other things that we're doing, we've suspended homemaker services. However, we're still contacting those individuals on a daily basis. We're doing grocery shopping for them and pharmacy pickup for those seniors.
Okay. Thank you. Any questions from the Board of Commissioners or comments before we move on?
Madam Chair, just one.
Yes, Commissioner Mitchell.
To Ms. Gilchrist.
Yes.
Okay, just thank you for all that you do. I think a job well done. Would you please, once again, share the numbers of seniors that you're just in contact with? We had a conversation prior to this, and I just want kind of the public to understand kind of all that you do, because I think you do a whole lot when it comes to the seniors in Douglas County. Can you kind of reiterate those numbers and the contacts and the outreach that you're dealing with, even though we've got some other plan and works to kind of reach out to those seniors that are being missed?
Absolutely. We, at the Senior Center located at 62 Fairburn Road, we have about 500 seniors that we interact with on a weekly basis. We have those who participate in our congregate program, also the ones who receive Meals on Wheels, and those that receive non-emergency transportation. So we have about 500 seniors in that program. And what we're doing, we're making sure if they don't receive a meal every day, we make contact with them. Some of our seniors elected not to receive a meal, those that participate in our congregate program. Some of them informed us that they were okay and they had enough food to last them through this time. However, we're still making contact with them on a daily basis. So staff will contact them via telephone to just check on them, make sure that they're okay, and to see if they have any needs. Our homemaker clients, the ones who were receiving homemaker services, our homemaker team, they're still contacting them on a daily basis, providing the shopping, the grocery shopping, and or the pharmacy pickup. For our Woody Fight Center, we have, again, in that database, we have over 9,000 seniors. However, for those who are active, about 2 weeks ago before the shelter in place, we did a drive-through goodie bag for them. So they were able to drive through Woody Fight, and we provided them with the goodie bag. We also provided them with helpful information and games and puzzles and things of that nature that they can do while they're sheltering in place. Further, we continue to, at 10 o'clock this morning, there was a Facebook Live game that our seniors were able to participate in. So any senior or older adult in Douglas County who would like that social interaction, that social engagement, can always go to the Woody Fight Facebook page. One of our staff is doing an outstanding job on providing interactive activities for those seniors daily. And it's usually at 10 a.m. We'll also begin to have one of our instructors, our exercise instructors, who will be providing live exercise classes and groups for the seniors.
Well, again, I just want to say thank you, but one last question though, and you may or may not know this number, but those that we're missing when it comes to seniors, do you have a rough estimate of those that are not part of the program that we're missing? Because there's some untouched seniors that are within our county that, from my understanding, that are not being serviced, that are not being, getting Meals on Wheels and so on. So do you have an idea what those numbers looks like?
No, at this time, I do not have a number. However, before the shelter in place and the COVID-19, we had several community engagement and outreach programs already scheduled, and that was going to provide us with further data and information. We're in the data collection stage right now of trying to see how many seniors we aren't reaching, and we're putting our outreach efforts out there as soon as we're able to move around in the community. One of the things that we had scheduled on March the 19th, we had a caregivers forum scheduled, the first of its kind in Douglas County. And what that would have provided us with the information that you're asking about right now, we would have been able to reach out to caregivers to see what their needs are. And we're going to start a monthly caregivers group, and this will provide us with some of that data that we're missing.
Good stuff. Well, thank you again, and job well done. And I look forward to when we get the Lithia Springs one online and all that good stuff. So we're looking forward to this and looking forward to working with you. Okay. Thank you again.
Thank you. Thank you so much.
Madam Chair.
Yes.
Someone has shared their screen. So if everybody could just check, somebody has shared the phone list for Douglas County. So if you would check your screen and X that out.
I'm sorry, that's me.
Okay, we're back now.
Oh, good. Thank you. Thank you, Dr. Gilchrist. Board of Commissioners, I believe that was the last comment. I can't see your faces. So we're going to move on to the approval. Thank you so much again, Dr. Gilchrist. We'll move to our approval of our minutes. Board of Commissioners, you have the commission meeting minutes of March 17, 2020, and the work session minutes of March 16, 2020, the special call meeting minutes of March 11, 2020, and the special call meeting minutes of March 27, 2020, and the executive session minutes of March 11, 2020. Are there any corrections or additions or deletions that need to be made?
No, ma'am.
No,
Being
ma'am.
none, thank you. Being none, the minutes stand approved as presented. Board of Commissioners, next we have our consent agenda. We don't have any other topics except the consent agenda this morning. I just want to remind you that all items are subject to final legal review. Tab number 5, resolution to pursue a 2020 roadside enhancement and beautification council grant, REBC, in the amount of $50,000 to be used for transportation gateway projects with no matches required, and authorize the chairman to sign all related documents. Tab number 6, authorization to approve an MOU with GDOT to install a roadway lighting at I-20 Lee Road interchange and authorize the chairman to sign all documents, related documents. Tab number 7, authorization to approve an MOU with GDOT to install roadway lighting at I-20 Chapel Hill Road interchange and authorize the chairman to sign all related documents. Tab number 8, authorization to approve a contract renewal with Terminus to serve as municipal advisor for Douglas County at a cost of $6,500 per month, and authorize the chairman to sign all related documents. Tab number 9, authorization to approve changes to Connect Douglas bus routes, route number 10, number 30, and number 40. Tab number 10, authorization to apply for the fiscal year 21 CJCC reimbursement grant for the Family Treatment Court, and authorize the chairman to sign all related documents. Tab number 11, authorization to apply for the fiscal year 21 CJCC Juvenile Justice Incentive Grant, and authorize the chairman to sign all related documents. Tab number 12, authorization to approve a change order number 009 with Motorola Solutions for the Public Safety P-25 radio system, and authorize the chairman to sign all related documents pending legal review. Tab number 13, authorization to approve an annual renewal maintenance agreement for New World, and authorize the chairman to sign all related documents. Tab number 14, authorization to approve a supplemental agreement number 2 to the consulting services agreement with VHB for the Maxim Road congestion and mitigation and traffic flow improvements project in the amount of $24,900 to be funded from the SPLOST funds set aside from Highway 92 Mount Vernon Road for services during the project construction phase, and authorize the chairman to sign all related documents. And last, certainly but not least, tab number 15, authorization to enter into a memorandum of understanding with the Georgia Department of Transportation for the county to provide in-kind services in connection with the LMIG and off-system safety striping projects, and authorize the chairman to sign all related documents. Board of Commissioners, that concludes our consent agenda. Do we have a motion to approve?
So moved.
Second.
Okay, we have 2 seconds. I heard Commissioner Mitchell first. We have a motion and a second. Any discussion on anything before I call?
Yes, Madam Chair.
Okay, call the questions. Okay, keep Vice Chairman Robinson.
Thank you. Director Hallman. Is she available?
Yes.
Director Hallman, can we address number 8, Terminus contract, please?
Sure.
Did we get clarification?
Sure. Yes. I'm sorry. I reached out to David Corbin after our work session, and he also reached out individually to y'all, I believe, via phone call. And he just wanted to stress, I think he just wants to be part of our team like he is with everything, with the ups and the downs. And he had requested that the contract be approved as submitted, but he wanted to make sure that the board knew that as we continue to move forward to address matters related to the crisis, that they would continue to make efforts to support the county in all facets of our operating environment. And so he just wanted to reach out to each of y'all, as well as to let me know that he's in this with us, and he's going to help us get through this. And he appreciates our longstanding support, and just continue on with the contract as it stands on the agenda.
Okay, so I'll be quick. So what was the recommendation out of the Finance Committee?
The recommendation was the $6,500 a month renewal.
All right, so that was the recommendation from the Finance Committee. And again, I'll just reiterate for the public who wasn't part of the work session yesterday that Terminus has provided us some great advice. They were our financial advisor that took us to New York to do the SPLOS municipal bond, funding, where we got a 1.71 rate. They're also very instrumental in helping us do due diligence on certain economic development projects to do or not to do. Very disciplined. As well as they were instrumental in helping us facilitate our recent TAN. Not a question of what it is and should we not do it, but more how to approach that to get the best rate we got, which I believe we've got $25 million, the max we could get at a 0.62 rate. So again, I just wanted to bring that out, that I do support the contract's renewal. Last thing is that, so Jennifer, in renewing this, it is my understanding is that David Corbin will also immediately move into stress testing with us through a process in which we're looking at our operating costs and helping us design certain trigger scenarios based on the future,
Yes.
the impending future. Is that accurate?
Yes, that is accurate. We're going to be, I sent him an email yesterday just telling him that sometime this week I was going to reach out to him and us start developing a framework on to be able to do some stress testing, even use that part of that model that was already designed, that he helped design a few years back. I think we could definitely incorporate that and just add to it, because it's always a work in progress, that model. And so, yes, he is going to be working with me on that as well.
Okay, thank you, Director Hallman. Madam Chair, I just got one more. Director Valentine.
Yes, Commissioner.
All right, thank you. I just want to cover the one dealing with Maxim Road, and then I'm going to yield the floor to my peers. Can we talk about Maxim Road and what I want to call regional mobility alignment in that area?
Certainly.
Go right ahead. Give a framework, and then we can get into what this is.
Yes, the Maxim Road project stretches from Thornton Road, and it provides improvements to the intersection to facilitate particularly truck movement. There is a heavy truck movement across Thornton Road in that direction. It also goes all the way up to Creekside Drive, and it provides sidewalk on both sides of the road up until Tree Terrace on the south side, and all the way to Creekside Drive on the north side. And essentially, there have been a number of incidents at that intersection with car crashes. There have been also incidents related to pedestrian movement. There are currently very limited sidewalks along that stretch of road, so this will improve the cartway itself, the paved area, and will provide sidewalk on both sides up to Creekside Drive on the north side and up to Tree Terrace on the south side.
Yeah, I mean, I'm very familiar with this area. Having when I first, grew up here in Douglas County, I lived in Tree Terrace right there before it became obviously Birch Landings. So I'm quite familiar with District 2. That being said, I'm also aware that Miguel, isn't this one of the most dangerous intersections, in at least the regional area? Is that accurate, by way of vehicle to vehicle deaths or vehicle to pedestrian deaths?
It is certainly up there in terms of the safety considerations. The amount of truck traffic on this area is one of the highest in the region because of the terminal, the rail terminal that is up on Cup County, up Maxim Road and Thornton Road. So the improvements that are intended for the intersection are to facilitate the truck traffic, because it was certainly not designed initially to handle that kind of volume. But yeah, the safety improvements are intended to minimize the potential for vehicular crashes, to facilitate the truck movement, but also to improve the safety of pedestrians that have been essentially walking along the edge of the road with no sidewalk to go to the grocery store and other facilities in that neighborhood.
Yeah, I mean, to that point, you got a north-south corridor, which is nothing but trucks, up to the transfer. You've got this east-west with all this traffic coming from Cobb pouring in right there. And then obviously you've got the local density associated with our citizens that lives at Silver Creek and everywhere else around there. And I think this is a long time coming. As you know, we've worked with our county commission of Cobb County across the way. They have a vested interest in this area as well, as far as safety is concerned. And so I appreciate your effort on helping move this project, which has been on the books for a while, but it takes what it takes because it is a state highway. I have no further questions. Thank you, Miguel. Madam Chair, I yield the floor.
Okay, thank you so much. Any other comments from the Board of Commissioners?
Yes, ma'am.
Commissioner Guider?
Yes, and I would like Chief Spencer to address item number 12 about the change order about the radio system. A lot of people, when they see change order, they think more money, but this is not the case. So I'd just like for him to explain it to the public, please.
Yes, ma'am. This change order, basically all it does is put our final acceptance date. It moves it out until June 30th. It was originally scheduled for April 30th, but with the COVID virus, they've not been able to complete the final testing. I do want the public to know that we are currently operating on this system. So the system is in use, and we've had very, very few problems with it. So we're really excited about it, and it is making a difference.
And so what coverage do we have now?
Well, we've got county-wide coverage. We also have the ability to talk to different agencies within our county. The Motorola is scheduled to come out next week and finish the installs for the fire department vehicles. And they're working on the sheriff's department vehicles after that. And then there's a couple other county vehicles, such as the fleet vehicle and landfill that'll be getting radios in their vehicles as well. But again, we are already working off that radio system.
So far, so good.
Yes, ma'am. We're very pleased.
Very good, very good. With that, I yield back.
Thank you so much, Commissioner Guider. Board of Commissioners, anybody else before I move forward? Board of Commissioners, we have a motion and a second on the table, but before I call the complete question, there are 3 levers usually that's on our electronic voting system, and it's yes, no, and abstain. But for the record, and today I would like the clerk, I'm going to call your name and you'll tell me yes, no, or whatever, or abstain, and then we'll have that for our records. So I will start. Board of Commissioners, we have a motion and a second, and all in favor or against, and what I'm gonna do, I'm gonna call your name. Commissioner Mitchell, what is your response?
Approval.
Is approval?
Approved.
Okay, okay, approved, okay. Commissioner Carthen?
Yes.
Okay. Commissioner Guider?
Yes.
Vice Chairman Robinson?
District 2 votes yes.
Yes. Okay. We have a unanimous vote and the motion carries. And my answer is yes as well. I'm so sorry I didn't vote. As the chairman of the Board of Commissioners for this county, my answer is yes. Board of Commissioners, we have a unanimous vote and the motion carries. Okay. Thank you. We'll move on into our announcements. And again, Board of Commissioners, I appreciate your time and patience this morning. I had 3 presentations that really were not originally on the list, but I felt that it was very important that you hear some of these items this morning because I want everyone to be well informed. Board of Commissioners, we have an announcements for Rick Martin, and then I'll circle back to make sure if you all wanted to update our citizens, certainly that would be great. Rick Martin, would you please start off, please?
Madam
Sure.
Chair.
Good morning.
Madam Chair, after the announcements, I think Lisa Crossman has a quick update as well.
Okay, thank you. Rick Martin.
Thank you. Thank you, Mark. Thank you, Madam Chair. Good morning, Board of Commissioners and staff. In terms of announcements, just want to share in light of the virtual world we are now living, one important announcement to make and share with the public is that we are working to stream all the committee meetings so the public has full access. When we have the committee meetings inside the courthouse, they're open to the public. So right now we're in the process of working to stream those meetings as well. And we will be utilizing our streaming on DCTV 23 Facebook, as well as Douglas County Happenings Facebook page just to share what's happening. I want to thank our station manager, TJ Jaglinski, for the work and effort. This has been as well as a difficult time for people affected by the COVID-19 virus. It's been challenging in terms of trying to communicate and share as much information as possible. We want to thank everyone for their patience and their effort to work with us in getting the word out that we need to get. So again, we're going to be streaming all our committee meetings as well as broadcast the commission meetings on DCTV 23, Comcast channel customers, as well as channel 99 for AT&T UVerse customers as well. We also wanted to share that the shredding event, Douglas County's great shredding event scheduled for mid-April, has been postponed. We postponed this until further notice, hoping to reschedule in the summer once the situation subsides. We also want to announce that the Taste of Douglasville has been postponed. I just received word late yesterday from the Cultural Arts, Douglasville, Douglas County Cultural Arts Council, that the Taste of Douglasville has been postponed. Want to share another announcement. We're going to we are going to be producing a virtual weekly update on Thursdays, directed by Chairman Dr. Rona Jackson Jones. We want to share the latest update that we can weekly, and we're going to call it the DCTV 23 Virtual Weekly Update on COVID-19. A little 4-minute news update of information. Our communications specialist, Lena Hardy, and myself will be bringing that. My team will edit. Our part-time video editor, Blake Livingston, will edit. We're going to try to produce it just to really help people. This is not replacing any other form of information. We realize that we have such a community of different ages, different ways of receiving communication. We want to make sure that we get as much information to the public any which way possible. So this is just another effort to make sure the latest information from the week is given. So we're calling this the DCTV 23 Virtual Weekly Update on COVID-19. And that is pretty much it as far as announcements are concerned. I want to make it clear that after today's meeting, we do intend to put up Deputy Director Lisa Crossman's presentation at the beginning of this meeting. We'll make that immediately available on the website for people to see and view, as well as the links pertaining to the mask links that she discussed at the beginning. And I want to thank you. Yield back to you, Chairman Jones.
Thank you so much, Director Martin. Any announcements for our Board of Commissioners before I call on Lisa, our Deputy Director? Any announcements? Okay. Deputy Director, Cobb Douglas Public Health. Lisa, you have the floor.
Thank you, Chairman. I just wanted to let you know that while we were meeting, we got approval from the City of Douglasville to open up the testing at Hunter Park. And so our staff will be working with the City of Douglasville and county folks as needed to be able to set that up to do testing before the end of the week.
Okay. Thank you for that great, exciting and promising news here for our citizens here in Douglas County. Any other comments? I would like to just close out by thanking our first of all, the Board of Commissioners, and then and most importantly, our citizens of Douglas County. Would like to thank our County Administrator, Mark Teal, for his phenomenal work with his department heads, and I appreciate all the things that the department heads have done to move this county forward in a moment, in a time such as this. Again, as I mentioned earlier, this is a marathon and not a sprint, and I appreciate the calmness and the ability to move things forward with your processes. Mark, thank you so much. You are providing those weekly updates to the Board of Commissioners and keeping us posted all the way in. Citizens, I would like to just I have a personal message for you. We will get through this. Behind every storm is a rainbow. And we will bounce back stronger than ever, and we will stay the course of social distancing, good hand hygiene, disinfection of surfaces, and now wearing a cloth mask. This has taken me back to the 1970s when I became a medic in the Army, and they didn't have reusable supplies at the time. We used cloth masks. They were double Muslim. That's what we call the material. And I'm beginning to relive history in a moment of time, but I want to assure you that we will get through this. Meanwhile, I want to provide to our citizens and make you just want to make it clear that your voice matters, and everything within this administration is being done to extend far beyond the ordinary to make sure that we address your safety and your health as we all deal with this new virus called the COVID-19. Our education and communication efforts have been tremendous. Our senior services are providing top-notch first-class services to our seniors, and I'm real proud of that. We have sent out guidelines and pertinent information to all our small businesses, and I'm working very closely with Sarah Ray, and she's, in fact, we spoke last night, and she said our small businesses are just excited about the information they've received about applying for our disaster relief. And also I called Sarah Ray last night just to, we're gonna be reaching out to our faith-based leaders about the payroll protection plan. I received that update last night from Ashley Bell, who is actually, he is the small business, he works for the Small Business Administration in Washington, D.C. He was on Congressman Scott call last night. So we will be getting that information out to all the faith-based organizations. Also, we are working to assist our homeless population. Myself, Mark Teal has been working directly with Judge McClain, and I've had a call with Mr. Charles Branson, and we're providing disinfection wipes and supplies and food and other resources that are needed for our homeless population at this time. Also, they just wanted to make it clear that the federal stimulus is on the horizon, according to Congressman Scott last night. So it appears that all the citizens, it depends on what category you fall in terms of your pay or the amount of money that you make. That depends on the amount of it depends on, it weighs heavily on what your stimulus check will look like. But of course, I wanted to let you know something was on the horizon. Also, I just wanted to let you know that the water and electric services here in Douglas County work with WSA, work with Greystone Power, and they have suspended all disconnections. So just want our citizens to just don't worry about if you don't have it, just don't stress out. I'm trying to relieve as much stress as possible. And again, the disconnections will certainly will not be suspended, but it's on a case-by-case basis. Our Douglas County Housing Authority, I've met with our director her name is Jennifer Freilish, and she's assured me that the 250 units within those housing units, there will be no evictions. So again, there's a moment to just kind of calm the storm because we have too much on our plates right now. This COVID-19 is a serious ordeal. Our sheriff department and our magistrate court, I've worked with them in tandem to minimize the writs and the possessory evictions for all over the county. So those are some of the things that I'm doing. I'm just making sure that you all, Board of Commissioners and the citizens of Douglas County, want you to know that I'm fully committed. And also just the information that that actually was released from Congressman Scott office last night about mortgage companies and your mortgages. There are forbearances out there for your mortgages. So please contact your mortgage companies because the last thing we don't want any foreclosures at this time. And we're working very hard to see what we can do to prevent that from happening. I have a telephone number for you citizens from U.S. Congressman David Scott, and I want to pass this information along. His telephone number is 770-210-5073, and that's for the office here in Smyrna. And he just wanted me to pass the information along. If you have any problems with foreclosures of anything on that magnitude, please give his office a call. And also just wanted to say that the income tax, you have we put some, I call it a guardrail around that instead of April 15th. Your taxes are not due, your income taxes are now due July 15th. At Wellstar Hospital, Craig Owens, who is the Chief Executive Officer, and also Jason Milholland, they were featured in the Sentinel newspaper last week. It got some promising news again. We have 8 additional rooms in the hospital with negative pressure. That negative pressure is very important to prevent the spread of COVID-19. So we have 8 additional rooms in the hospital. So that's very promising. Right now, our capacity is at where it should be in the hospital. So I have not received any updates saying that we're in trouble on that end, because we're doing some things that are proactive on our end as citizens with that social distancing, the hand hygiene, and of course, now the mask. So I just wanted to leave you with the note that we will get through this. And this is, it breaks my heart. I'm telling you, I'm up all night long. And in my lifetime, I've just had extreme situations, particularly in surgery, and I've been at the table with gunshot wounds and everything you can possibly think of. And in order to get through it, I had to have a calm demeanor, and I've never forget, and I'm just gonna give you a story, and I don't usually tell many stories, but today I will. Worked with Charlie Hall Ashford on a gunshot wound. I was 23 years old, and I was on part of the surgical team, and actually was just helping just briefly in the room and wanted to walk out. And this doctor operated in his suit because he had an Armani suit. I'm not sure if our citizens are, I be honest, at the time, I didn't know what it meant, but it's a very expensive suit, but he did. He said, you can cure infection, but you can't cure death. So he operated, but I was not part of the team, and I wanted to walk out of the case. Once we got everything set up in the room, I was leaving. He said, Ramona, I need you to stay because of your calm demeanor to help me get through this case and get this bullet out of this young man's chest. And I'll never forget his words. So please, citizens, if I look calm on the outside, believe me, on the inside, I am just so committed, because this you mean so much to me. And Douglas County is number one. And I said the first day I took office, there's no room for second place. And I'll leave you with this. We will get through this, and we will be celebrating, because we will all say that our discipline allowed us to get over the hump and flatten this curve in Douglas County. Thank you. If there's nothing else to come before this body, this meeting is adjourned. Thank you.